Next witness. 2 minutes, please.
Hi, my name is Stella Armstrong. I am the drug abuse coordinator for the Bonnie Morgan Foundation for HCV. I actually am just going to put this away and talk to you. I've had hepatitis C for over 30 years. I contracted it in 1980 from using drugs, intravenous drugs. I've been clean for 15 years, and that was when I found out in 2000. That's when they actually started to say, oh, they named it, and it came up with hepatitis C. I lived for those 15 years, or for the last 10 years actually, with the hepatitis C, not having a cure for it because the older cure was just not something I wanted to do. I figured, you know, nobody really knew a lot about it. The awareness is a lot better now, but getting the word out to people in drug communities, in NA meetings, in any of those kind of settings is good for me because it helps me keep me where I'm at, and it also helps me give them a chance to get tested, to get treated. I lead them in the directions, and I showed everybody, I had a list of 5 places of where in San Diego that we can go, and there was 5 places where you can go. It's small, no exchange, no needle exchange, no testing. We need that. We need that a lot. I mean, that's San Francisco, Sacramento, they have all that, but I just want to echo everything that Cal said and not take up a lot of time, but just say that proposal, I'm looking forward to it being passed and showed on budget.
Thank you very much for your testimony. Final 2 witnesses, please.
Hello, my name is Samuel Gonzalez. I am the HIV and Hep C coordinator for St. John's Well Child in South LA. And we have started an HIV and Hep C program. We had over 70,000 patients come to our facilities last year, and we were only able to test about 5,000 for Hep C. And of those 5,000, we see that over 500 have actually tested positive for the Hep C antibody. Of those, we've seen probably 30 in our clinic to actually start treatment, and all have been denied treatment. So I think treatment or actual testing is a great form of prevention, because one of our patients actually infected his son who shared his toothbrush. And so if the patient had known that he was Hep C positive before and was educated on what they could do to prevent the spread to family members, that would have been very essential in further spread of the virus. So I fully support CalHEP's proposed budget and really strongly think that in South LA and in disproportionate populations, that education is #1 in prevention. Thank you.
Thank you very much. Final witness.
Good afternoon, Glenn Backus, 30-second testimony. Glenn Backus for Project Inform. Project Inform is a national organization founded in 1985 to advance medical care, public health, and policy for the control of HIV and hepatitis C. I'm aligning myself with the comments of the Alliance, the HIV/AIDS Alliance, of which we are a member, in support of their budget request. And additionally, I will share with Senator Stone's office the wealth of research on why people share and what are the policy fixes for that. Thank you.
Thank you very much. Dr. Mark, anything you'd like to respond to? It was a pretty hefty public testimony.
No, thanks.
Nothing. Okay. Thank you very much. We're going to hold all the items open. We're going to move on to item number 5, Infant Botulism Treatment Program, production of Lot 6, page 32 of the agenda. This is the item that we're proposed to take action on, colleagues.
Madam Chair, members, Drew Johnson from the Department of Public Health. This proposal requests $2 million in expenditure authority to facilitate the ongoing manufacture of Lot 6 of Baby Big. Baby Big is an orphan drug that is used for the treatment of infants who are infected with botulism. CDPH is the only source of Baby Big in the world. It is highly effective and efficacious. It shortens hospital stays by up to a month, from 6 weeks to 2 weeks. It saves hospitals and insurance companies up to $100,000 per each case. It's a very fluid and dynamic manufacturing process, however. Due to FDA requirements that are new, changing, there's processes and procedures that evolve in each development of the 5 to 6 year budget cycle, or lifetime cycle to develop Baby Big. And so you're seeing an increase of $2 million in expenditure authority for 15-16 to facilitate that ongoing manufacture.
Finance, LAO.
Recommend approval.
Any
Ma'am.
questions? Mr. Stone.
I would like to make the recommendation that we follow through with this recommendation.
So can I interpret that as a motion?
Yes,
Excellent.
my first one.
How about that? All right. Okay, and it's been seconded. Let's call the roll call, please.
Stone,
Yes.
Monning.
Aye.
Mitchell.
Aye. You want to call roll call? Well, Mr. Stone, we called roll call for your first motion anyway. How about that?
Thank you.
All right, thank you very much. It's been accepted by the committee. It'll be recommended to the full budget. On the assembly, we voted. I don't know what they do over here in the Senate. That's very funny. Thank you very much. We're going to move on to item number 6, oversight of licensing and certification program. Didn't we vote, Mr. Martin? We voted in the assembly for recommendation. Didn't we take action? She's telling me we don't do that here. Oh, okay.
We didn't do seconds.
We didn't do seconds. Got you. Okay, sign language.
And we announced.
The announced passage. All right. Okay, well, I wanted to, for Mr. Stone's first motion.
That was very much appreciated.
You, with seconds. No, we don't. Okay, we're going to be straight by the second hearing. We're going to be perfect. Good afternoon.
Good afternoon, Madam Chair and members.
Going to go ahead and make your presentation on oversight of licensing and certification program. Page 34 on the agenda.
I am Jean Icino. I am the Deputy Director of the Center for Healthcare Quality at the California Department of Public Health, wherein the licensing and certification program resides. I plan to just give you a brief overview of the program and just roll right into answering the questions that were in the agenda.
Thank you.
So, licensing and certification program licenses approximately 30 different types of healthcare facilities and agencies so that they can legally do business in California. And via contract with the Federal Centers for Medicare and Medicaid Services, we verify that healthcare facilities meet certification standards to receive Medicare and Medi-Cal funding. We also investigate complaints and entity-reported incidents regarding concerns expressed about care provided by these health facilities and providers. We license nursing home administrators. We certify nurse assistants, home health aides, and hemodialysis technicians, and we oversee training programs for those categories. We also investigate complaints against individuals, certified individuals, that involve allegations of abuse, neglect, and misappropriation of property and professional misconduct. And we educate consumers via our health facilities consumer information system website that maintains information about licensed long-term care facilities and hospitals throughout California. So I'll move on to our estimate. The estimate that helps us project the workload associated with our licensing and certification activities and the resources that we need to perform these functions. To estimate our workload, we use a fairly basic formula. We estimate our number of complaints and a standard average hours it takes to complete a complaint and our projected number of complaints. And then for the survey workload, we also use standard average hours multiplied by a facility count, multiplied by a required frequency for performing that activity. So our estimate methodology has not changed. However, since last year, we have changed how we measure the critical data inputs into that methodology. So first was how we compute the standard average hours to accomplish any particular activity. In the past, our estimate used time spent on complaints and entity-reported incident investigations based on the date that our surveyor exited a facility. This year, we used the date the investigation was actually closed out. So this captures workload that we had been missing before in the estimate from the time the surveyor exits the facility but continues to work on that complaint, writing up their findings and fully completing the investigation. Secondly, we changed how we estimate the number of complaint and entity-reported incidents for the coming year. In the past, we used the number of complaints that had some hours worked on them in the current year. This year, we counted all the complaints and entity-reported incidents that we received in the prior year, not just those on which work had been done. So this, again, captures more, a better estimate, we believe, of our complaint workload for the coming year. And finally, we added a new component to the estimate this year to reflect all of the open complaint and any entity-reported incident investigations as of June 30th of 2014. In the past, we were failing to capture in the estimate for the coming year the workload that we had remaining uncompleted from the prior year. So by changing the way that we calculate these inputs into our estimate methodology this year, our November 2014 estimate indicates that the licensing and certification program requires additional funding authority and staff to complete our mandated workload, including completing complaint and entity reported incidents that remain open from prior years. We will continue to review and refine our LNC estimate data inputs and methodologies each year. In particular, we are continuing to refine our timekeeping system, which helps us compute our standard average hours, and to improve our program's ability to accurately capture and assess surveyor time and staff needed to complete our mandated activities. So as a result of the changes in our estimate methodology and the workload and resources that the estimate demonstrated for us, we have 4 budget change proposals before you today. Our first is to increase contract funding for Los Angeles County. In Los Angeles County, the workload, the licensing and certification workload is completed via a contract with the county on behalf of the state. And so we have a proposal to add $9.5 million from the Licensing and Certification Special Fund to augment the Los Angeles County contract to perform licensing and certification workload on behalf of the state. We have a budget change proposal that seeks 3 positions and $378,000 from the Licensing and Certification Special Fund to provide on-site oversight and improve the efficiency and effectiveness of the Los Angeles County's contracted licensing and certification activities. Some of the oversight activities that have occurred with our program, the BSA audit and the Hubbard Consulting report that Dan Kim mentioned earlier, have raised concerns about the state's oversight of the Los Angeles County contract, and we acknowledge those concerns, and these 3 additional positions are part of our multi-pronged efforts to improve our oversight and work with Los Angeles County. And we have proposed to establish those positions administratively in the current year, and in fact, we have already filled 2 of those 3 positions. Our third budget change proposal seeks one-time funding in the amount of $2 million from our internal department quality improvement account to contract with vendors to help us enhance our business practices and quality improvement efforts to address many of the recommendations that were in the consultant report. This fund is used only, we can use it only on appropriation from the legislature for the specific purpose of conducting quality improvement projects within the department. And finally, our last budget change proposal seeks an additional 237 positions at a cost of $19.8 million from the Licensing and Certification Special Fund for the state to address the workload in our November estimate. The questions related to our budget change proposals were: how will these proposals address oversight of complaints, accurate data, formal policies, timeframes for initiating complaints, and oversight of our district offices? These questions raised in the agenda are basically mirror the findings of the Bureau of State Audits. So first, this increase in staffing and funding for Los Angeles County to increase our workload timeliness goes a very long way to addressing many of the problems that were raised. But in addition, we have taken numerous other steps to be doing better on our workload in the meantime. Most significantly, we've been developing performance metrics on the volume, timeliness, and disposition of long-term health care facility complaint and ERI investigations. And we are posting these metrics quarterly on our website. We have just recently posted our second quarter of data, and our next quarterly posting of these metrics will include a breakout of these performances by our district offices. We have been modifying our data collection processes to improve the timeliness of open investigation complaints against certified nurse assistants. We are working to develop and update written policies and procedures to ensure appropriate supervisor review and reduce variability among district offices. This was a particular item that was raised by the Bureau of State Audits, and we have hired retired annuitants to help us update and issue policies and procedures. We are developing criteria for reviewing complaint and ERI prioritization and quality of investigations, and we have been conducting monthly reviews of a sample of complaint and an ERI investigations in Los Angeles County. And by October of 2015, we will, as we refine these criteria, we will use them to conduct a monthly review of a sample of the quality of investigations in all of our district offices statewide. And as of December 1st of 2014, we have filled 15 of the 18 positions that we received through a spring finance letter last budget in our professional certification branch to improve the timeliness of our investigation of complaints against the individuals that we certify. In addition, we're conducting quarterly visits to each of our district offices to ensure compliance with our policies and procedures. And during these visits, our branch chiefs discuss investigation monitoring with district office administration and supervisory and management staff. And again, this was one of the items that was highlighted at the Bureau of State Audits, that we had inconsistent levels of supervisory review across our district offices. So in addition to those items specifically aimed at the issues the Bureau of State Audits raised, our Chief Deputy Director mentioned to you that we had a consultant report that provided us with 21 recommendations that address more specifically the internal workings of the department. And I wanted to present to you a number of the things that we're doing to address the recommendations. So first off, we have developed a work plan with timelines specific to each of the 21 recommendations from the consultant's report, and that work plan and updates are posted on our website. Since beginning in September of last year, we have held 3 public stakeholder meetings to receive input on the work plan and other activities going on within the department. We have developed a strategic map for the center that is currently also posted on our stakeholder website, along with a survey that any stakeholder can use to provide comment and review on our strategic map. We have been working very closely with Los Angeles County to improve our oversight and supervision of the Los Angeles County contract. We mentioned we've already hired 2 positions that are requested in the BCP, plus we had previously hired a retired annuitant that works in Los Angeles County. We hold weekly meetings with our Los Angeles County counterparts to address ongoing issues, and we continue to work with the county to provide training to improve quality of investigations there. We have created a data integrity group to help ensure the quality of our data. We're posting performance metrics, but as we've begun doing that, we've identified problems with data quality, and so we're working hard to address those. We are developing a scope of work for a contract for someone to advise us on recruitment and retention of nurses, which are the primary staff in our field survey work. We are nearing completion of a business process redesign for our central applications unit and our professional certification investigations unit. We are developing a centralized citation tracking log to help us improve the efficiency of issuing our citations. And we are testing tablets for use by our surveyors in the field to replace currently cumbersome laptops and try to increase the efficiency of our field work. And finally, we have engaged in a work group process with our Office of Legal Services within the department to identify and prioritize regulations for the coming year. We have many regulation packages that we need, and we have prioritized adverse event reporting, clarifying the terms for adverse event reporting, clarifying requirements for change of ownership in licensed skilled nursing facilities and hospitals, clarifying the medical information breach process, and developing per statute guidelines for training curriculum for skilled nursing facility staff concerning residents who are lesbian, gay, bisexual, or transgender. There was a request to update you on the contract negotiations with Los Angeles County.
And when you do that, could you just kind of put it in context, since the LA County contract is a unique kind of
It is.
animal?
So, yes.
If you could just give us a context,
Absolutely.
then we can understand.
So the state has contracted with Los Angeles County to perform the licensing and certification workload in the county for over 30 years. So there's no longer anyone on board that can provide the historical knowledge of exactly how that relationship began, but it has been progressing for quite some time. We are coming to the end of a 3-year contract with Los Angeles County. That contract will end on June 30 of this year, and so we are engaged with Los Angeles County to renew that contract. And one of our budget change proposals, as I mentioned, includes additional funding for the Los Angeles County contract. We have heard from our partners in Los Angeles County their concerns and issues that they have raised about the funding in our BCP, and we will absolutely consider those comments as we continue in the process of negotiating a new contract. We just want to point out that the timing of the state budgeting process doesn't always line up with the timing of the negotiation for a new contract. And so therefore, the funding model that we used for our budget change proposal were based on salary and benefit rates at a certain time, and our contract negotiations will consider those issues.
Any questions you have? Yes. Yeah. Senator Stone.
Thank you for your presentation. I appreciate your historical perspective on why LA County is the only county in the state of California that we contract with to perform this state service. And let me also qualify that I believe in local control. So I kind of like the fact that LA County is doing it. But one of my concerns is that LA County is negotiating with their nurses to do these evaluations. And in the state of California, we pay between $59,000 and $77,000. And I understand, and maybe the LAO can chime in, that they're negotiating $102,000 per year, and of course they want the state to pay for that. I don't know if that's part of your budget addition for these increased in salaries, but that means we'll be paying LA County nurses up to 73% more than the state pays many of our other workers throughout the state of California to perform the same tasks. So, just because we've been doing it for 30 years, should we continue to do it for another 30 years? Especially when we're finding that it's going to be costing the taxpayers much more money, and is it not going to create inequities and other nurses that are going to say, if they are getting that kind of money, why aren't we getting that kind of money, and create some negotiating problems for us in the state of California?
You are correct, Senator, that there is a disparity between the rate that Los Angeles County has contracted to pay their nurse surveyors versus what the state civil service classification pays for the nurse surveyors. And that therefore does increase the cost of the contract. And that's one of the areas where in our past contract, the funding fell short when there was another increase in salary in mid-contract. Then the funding in the contract was not sufficient to cover that.
I mean, would it not be appropriate, I'm thinking as a private businessman, we tell the County of Los Angeles, this is what we pay to provide this service. We've given you the opportunity to do the service yourself. If you want to go above the mean, what we pay other nurses in the state of California to do this role, then you need to fund that yourself. You're negotiating the increase in salary, you should pay it. So why don't we take that tact and, again, trying to shave and save the taxpayers' money wherever we can? Maybe the LAO can also respond to that.
Sean Martin with the Legislative Analyst's Office. Our understanding is that the state nurses are paid $77,484 a year in salary, and that the department calculated their proposal based on a salary of $102,107 per year for a health facilities evaluator nurse. However, we recently heard from Los Angeles County that they expect the health facility evaluator nurse salary to be $104,148 in the budget year, so it may be slightly more.
So it's even higher. So since that contract is coming up, would it not be appropriate when we're dealing with Los Angeles to give them the option to let the state take over that responsibility at a lower cost, or have them supplant the difference of what it costs what it would have cost the state of California to do the same?
Well, Senator, the contract negotiations are ongoing. The state is not in a position to immediately assume the workload that is currently contracted to Los Angeles County. It is a significant portion of the statewide workload. And we are already through our budget change proposal asking for a significant number of new nurse positions that we will need to fill, and it would not be possible for us to immediately backfill behind Los Angeles County.
And even though there's no one here that was there during the original negotiation 30 years ago, I bet that probably was a motivating factor back then, just in terms of LA County have the lion's share of the business, if you will, and the state's inability to manage that.
Well, it
quite
certainly
frankly.
is the largest county in the state of California. I understand that, but I don't think it's appropriate that we have a nurse that's in San Francisco County delivering services and making significantly much less money for providing the same tasks. So maybe you're not in a position to backfill all those nurses in a state-run program, but maybe we shouldn't be signing 3-year contracts or 5-year contracts. Maybe we should go with 1-year contracts with 1-year extensions and start phasing in a state resumption of those services at a much less cost to the taxpayers, and providing parity for other nurses that provide the same roles. Because if I'm a nurse in San Francisco County and I say, hold it a second, I live in a county that has one of the highest rents, mortgages because of property values in San Francisco County of probably any other county in the state of California, yet my counterparts in Los Angeles make $100,000 and almost $5,000 a year to my $59,000 to $77,000. Why are they getting paid more money than we're getting paid when we're doing the same work and we have a higher rent to pay than we do down there? So these are questions I think are appropriate to be asked when the taxpayer is on the hook for paying this money. And like I said, if Los Angeles wants to give them $200,000, that's between them and the nurses and the constituents in LA County to deal with their board of supervisors. But we shouldn't, the taxpayers of the state of California, be supplanting that contract. They should be paying the difference.
We understand your concerns.
And can you enlighten us all, and I know that there's LA County representatives here as members of the public, but as opposed to looking at housing costs as kind of the determining factor, can you enlighten us about the workload of the nurse evaluators in LA County versus others across the state?
Well, so I'm not quite sure of your question. Let me just say, and then, so the Los Angeles County nurses use the same timekeeping system that the state does. All of our nurse surveyors put their time into our timekeeping system team, and it's that data that we use to calculate standard average hours. And so when we budget standard average hours, that's a statewide average that we calculate, and therefore when we budget nurses for the Los Angeles County portion of the workload, they're budgeted at the same standard average hours to achieve any task as a nurse surveyor.
So not standard average hours, but workload as I'm defining it, maybe it's the wrong terminology, in terms of their job as nurse evaluators and their responsibility in terms of a caseload or whatever the term may be in terms of number of sites they see. We've talked about, we're all assuming one of the reasons why LA County may have their own contract is because of the sheer volume. As you said, the state wasn't in a position to try to take that over in terms of woman power capacity with what the state has. And so I guess the question is, and maybe LA County can answer, in terms of number of facilities per evaluator. Am I framing that right? Does that make sense?
I understand. Now I understand your question.
Okay.
That's not a metric that we currently measure. Or we don't assign workload by a certain number of facilities or complaints per
Got
nurse
it.
surveyor.
Interesting, okay.